Dr. Fauci, update us, please, on dealing with HIV, AIDS, both how it's being dealt with as far as the disease spread, and then also, of course, in your neck of the woods, actually being able to fight the illness and combat it when people are infected.
Well, HIV, we still have a very serious global pandemic. There are over 33 million people who are infected worldwide. Greater than 90% of them are in the developing world, and 67% of them are in southern Africa. There are 2.7 million new infections each year and 2 million deaths. So it's still a very, very serious problem. Even here in the United States, we have 56,300 new infections each year, which is really something we've got to get our arms around and stop that, because it's been that way for well over 10 years. With regard to treatment, treatment is superb. For those people who have access to therapy, the drugs we have now have completely transformed the lives of HIV-infected individuals. Care of HIV-infected people right here at the National Institutes of Health in the summer of 1981, if someone would come into the clinic, they would be seriously ill and they would likely be dead within 26 weeks. Now, with the therapies that we have available, if a 20-year-old person comes into the clinic who's newly infected and you treat them with the very good drugs that we have available, if you do a mathematical modeling, it is very likely that person would live to more than 69 years, which is an enormous advance. The critical thing that we have to address is the issue of prevention, because we're still having people getting infected, and that's really unacceptable. So we have to continue to push our prevention modalities that have been proven to be effective. It's an interesting statistic that there are a lot of prevention modalities ranging from the use of condoms, needle exchange, mother-to-child transmission, behavioral modification, a variety of other things that we can use, and yet only 20% of the people who would benefit from these prevention modalities actually have access to them. So it's a combination of major advances that have been made in treatment and in prevention, but getting those modalities to the people that need them. So there's still a lot of challenge and much, much more to do in this very, very difficult situation we're in with a pandemic that's still raging. So a lot of good news, but a lot of challenges ahead.
In a release from NIH, it says that more than 1.1 million people are estimated to be HIV infected in the United States. Someone is infected with the virus every 9.5 minutes, and it's disproportionately affecting racial minorities and men who have sex with men. And the release points out that it's not only a young person's disease. Approximately 1/4 of HIV-infected adults in the U.S. are at least 50 years old. And individuals 50 years of age and older account for approximately 10% of all new HIV infections. What is NIH's role as we look at HIV and AIDS compared to other departments, other branches within Department of Health and Human Services?
Well, if you look at the major groups that are involved in addressing this, it's the NIH, which does the basic and clinical research to develop new drugs, to test them and determine how best to use them. Big challenge of developing a vaccine. Big challenge of developing prevention modalities. The other agencies within HHS, like CDC, plays a major role in surveillance of disease, in prevention modalities, and making sure that when you have disease that's predominant in a certain area, that you educate them, that you get public health programs implemented. The FDA, which is the organization that's involved for the regulation of the drugs, the vaccines, etc., plays a very important role, all of which complement each other. So you have programs within the federal government to get drugs available to people who cannot have otherwise access to drugs. So it's really very synergistic and complementary within the Department of Health and Human Services, anywhere from the research to the surveillance to the prevention to getting safe and effective drugs to the people who need them.